Hi, this is Dr. A with your 5th edition of Niles Intro to U.S. Healthcare. We're continuing our look at the government's role in U.S. healthcare. This is the second lesson, and we're going to look over all the federal agencies that are involved in healthcare. So as we finished in the first lesson, the U.S. Department of Health and Human Services is the most important federal agency with regard to healthcare. It is a cabinet-level executive branch of the federal government, and our textbook says it has 11 operating divisions, but if you go look on their website and count, I counted 13. So maybe they expanded or changed a few things, but we're going to look over all of these different divisions, and of course they always collaborate with the state and local governments because the activities happen at the state and local government level. All right, so the first one we're going to talk about is the CDC. It was established in 1946 and is headquartered in Atlanta, Georgia. The mission of the CDC is to protect health and promote quality of life through the prevention and control of disease, injury, and disability. The CDC's main goal is public health, and we'll see a lot of these federal agencies have a role in public health. Public health will be the subject of the next chapter also. And the CDC, for example, played a huge role in the pandemic regarding health policy. So looking at determining vaccine schedules and recommending mask wearing or not. And then you could see that these recommendations were done at the federal level. CDC put out their recommendations, and then the states would enforce this in different ways. So the next one is the Administration for Community Living. It was established in 2012, so this one is a new one. So that would be something that got put in place post Affordable Care Act. It is responsible for increasing access to community supports while focusing attention and resources on the unique needs of older Americans and people with disabilities across the lifespan. So the idea of this administration is to try to prevent putting people that are either disabled or elderly into institutions like nursing homes. Now, there is a role for those nursing homes, and if a person needs to go there, that's fine. But generally, people are happier living in their community, the community where they're from. And a lot of them could if they have the resources. And so this administration is there to provide these resources at the community level to allow people to stay in their homes. Again, it's the principle that older adults and people of all ages with disabilities should be able to live where they choose, with the people they choose, and with the ability to participate fully in their communities. So they have a lot of neat programs. One of them you might know is Meals on Wheels, to deliver prepared meals to people in communities that may not be able to cook for themselves, or it might be too dangerous for them to cook for themselves, right? The next one is the Agency for Toxic Substance and Disease Registry. So it is a lead federal public health agency responsible for determining human health effects associated with toxic exposures, also preventing continued exposures and mitigating associated human health risks. So if there is a poisoning or there's anything like that, that's like somebody comes with exposure to toxic chemicals or something, all of these things diseases have to be reported to the ASTDR, and it is administered organizationally with the CDC because it's preventing disease, and so that is part of the same overall mission. But this one is just about toxic chemicals, toxic exposures within the environment, within work, or things like that. Next, we have the National Institutes of Health. So this is the primary federal agency for research toward preventing and curing disease worldwide. It has 27 institutes and centers that can focus on different diseases and conditions. For example, there's the Cancer Institute, there's ophthalmology, there's a Heart, Lung, and Blood Institute, there's a genetic one, there's one on aging, there's an institute on alcoholism and drug abuse, on infectious diseases, on chronic diseases, on children's diseases, and on mental health. There are a bunch of them out there. And so you can visit the NIH's website to see all the different institutes. And NIH does a lot with funding research that are happening at universities and other institutions, but they also conduct some of their own research. So you can work for the NIH, but you can also work at a university and do research and be funded by the NIH. If you have to submit for it, and your proposal has to be accepted. But this is all to further science, but towards, of course, preventing and curing diseases. Next is the Health Resources and Services Administration, or HRSA. It's the primary federal agency for improving access to healthcare services for people in every state who are either uninsured, isolated, or medically vulnerable. And so I'll give you as an example, a friend of one of my kids was in the Ryan White program that is administered under the HRSA, and she has HIV, and this program was helping her with get her medication and having a place to stay, and so it was imperative, of course, for her to stay in the program. But there's a lot of different programs like that. Tens of millions of Americans get affordable health care and other help through 100+ programs that HRSA has, and there are more than 3,000 different grantees, which would be more local institutions that help with those programs. Equitable health care to the nation's highest need communities is what HRSA does. Their programs support people with low incomes, people with HIV, pregnant people, children, parents, rural communities, transplant patients, and the health workforce. So they have a lot going on. The next one is the Indian Health Service. The mission of the Indian Health Service is to raise the physical, mental, and social and spiritual health of American Indians and Alaska Natives to the highest level. It ensures that these tribes get comprehensive, culturally acceptable health services available and accessible to them where they are. It provides a comprehensive health service delivery system, so there are actually hospitals and clinics that are part of the Indian Health Service, and they serve approximately 1.9 million American Indians and Alaska Natives who belong to 566 federally recognized tribes. So this was one of the government's programs and concessions to the fact that the land was taken from these tribes, and it's almost like a repayment of it. And so these clinics and these hospitals are federally funded through the Indian Health Service. And of course, it's not as if it's fully funded, but so that's kind of the idea and history behind it. Next, we have Substance Abuse and Mental Health Services Administration. So it's the main federal agency for improving access to quality substance abuse and mental health service in the United States. But it works with state, community, and private organizations then to increase access to these services. Next, we have the U.S. Food and Drug Administration, also known as FDA. It is responsible for ensuring that the following products are safe. So food, right, and drugs, but also human and veterinary products, biological products, medical devices, cosmetics, and electronic products. So like biologic products could be something like the immunotherapies and vaccines and things like that. Medical devices could be things that are like put in, also implants and things like that. Cosmetics, of course, makeup, etc., things that you put on your skin or your face. Electronic products can be electronic health records, but can also be different programs that are health related. So now we're also going into the health apps and things like that. But also things like anything that can monitor like oxygen, respiratory rate, heart rate, those things. So if it's sold and it's related to health, chances are the FDA has something to do with it. It is also responsible for ensuring that the consumer product information is accurate. And so they're also behind some of the legislations rules behind what can be said or not said on a product, the health claims that can be made. And so, for example, you will rarely see on a label for a supplement or something that it cures something or it helps a certain condition, but rather it allows for like systems-based claims. So we can say supports cardiovascular health. That would be something that is allowed versus cures heart disease would not be allowed as a claim on the label of a product. The FDA also advances public health by speeding up innovations to make medicine and food more effective, safer, and more affordable. They had a huge role in improving the COVID-19 vaccines, faster than they normally would have been. Next, we have the Administration for Children and Families. It is responsible for federal programs that promote the economic and social well-being of families, children, individuals, and communities. They have 10 regional offices and 22 separate offices also. So it's a rather large administration. And so, for example, they have the early childhood development in like Head Start and child care, for example, child support services, right? Community services. Also for refugees resettlement, the Office on Trafficking in Persons. So if you see ads and things about human trafficking and awareness and all that, it usually is coming from the ACF. We have the Office of Family Violence Prevention and Services, with youth and families, and so there is a lot going on here and a lot of good that they do. Next, we have the Centers for Medicare and Medicaid Services, also known as CMS. And it was established, of course, when Medicare and Medicaid programs were signed into law in 1965. And it has over 20 offices that oversee different aspects of their programs. The primary responsibility of CMS is to provide policy, funding, and oversight to healthcare programs that serve the elderly or the poor. So if a hospital serves or accepts Medicare or Medicaid, they're automatically under all the rules and regulation of CMS if they receive money, federal money, for those patients. As part of the Affordable Care Act, the Innovation Center was established for the purpose of testing innovative payment and service delivery models to reduce program expenditures while preserving or enhancing the quality of care. These were for individuals who receive Medicare, Medicaid, or CHIP benefits. We'll talk about CHIP as the Children Health Insurance Program. So quickly, I will just mention, so that's health insurance for children whose parents make too much to qualify for Medicaid, but maybe don't make enough or don't have insurance through their workplace or can't afford insurance through their workplace. And so it's a certain income bracket that does those. And so this idea of this innovation center was to kind of delegate to the people that are boots on the grounds, how could we do this better? How could we bundle things or services and things? And so you can, if you have an idea, you can put in for it as a pilot study to see if you can save money on these Medicare or Medicaid or CHIP patients. Next, we have OSHA, Occupational Safety and Health Administration. It was established to govern workplace environments to ensure that employees have a safe and healthy environment. And so this applies to all industry beyond healthcare, but of course, it has a big role in healthcare, and especially during the pandemic, to make sure that employers had safe workplaces during the pandemic. And so all of the warning signs and rules, safety rules, all come out of OSHA. Next, we have the Surgeon General and the U.S. Public Health Service. The Surgeon General is the nation's chief health educator, and he can put out those some of those black warning labels on products. He or she also provides information on how to improve the health of the U.S. population. This person is appointed by the president, And it oversees also the operations of the U.S. Public Health Service Corps. The U.S. Public Health Service Commission Corps consists of 6,500 public health professionals who are stationed within federal agencies and programs. So that, for example, they can be stationed at the CDC. And they played a role in educating the public about COVID-19. Then we have the Department of Homeland Security and the Federal Emergency Management Agency, so DHS and FEMA. DHS was established in 2002 as a result of the 2001 terrorist attack on the United States. It combined 22 different federal departments to form the DHS. And FEMA, which is responsible for managing catastrophic events, was integrated then into DHS in 2003 because they have a lot of overlapping responsibilities, so they integrated them together. And so they are responsible for coordinating efforts at all government levels, from local, state, federal, all that, to ensure emergency preparedness for any catastrophic events such as terrorism or bioterrorism. So we're in healthcare, we would be more concerned with bioterrorism, but terroristic effort like bombings and things like that can also, need a response that is appropriate to manage the casualties and to manage the possible effects of it. So last, we have the Office of the Assistant Secretary for Preparedness and Response. It was created under the Pandemic All Hazards Preparedness Act in the wake of Hurricane Katrina to prevent, prepare for, and respond to different adverse health effects of public health emergencies and disasters. So it does focus on preparedness, planning, and response, helps build federal emergency medical operational capabilities. It does countermeasures research, advances development and procurement, and grants and strengthens hospitals and healthcare systems in public health emergencies and medical disasters. All that to say, for example, with Hurricane Katrina, there was massive flooding in New Orleans and in the area. And then, of course, you had so many people that were, relocated to different places. But then if they wanted to return, you had to deal with all the contamination, all the mold and the things that were, not the areas that might not be livable, that had to be restored, access to clean water and things. So whenever there's a disaster, it's not just a 1 day or 2 day thing. It can take months, sometimes years for it to be recovered. So, for example, in our area, we had a tornado that destroyed a high school. And so there was, they had some plans on how to respond, where people were moved to, how did they finish the school year, how fast was the school rebuilt, etc. So anyway, so that is the last one that we are covering. And so that is a lot of the different federal agencies that are involved in healthcare. We are going to talk about state and local level things in the third installment of this chapter's lesson. See you there.